Hi, this is Dr. Paul, and we're talking with Dr. Garrett Bode, chiropractic physician right here in Oldsmar, Florida. And the topic we're talking about is some of the common causes of pinched nerves. So, Dr. Bode is a chiropractor. Boy, I bet you see a lot of pinched nerves.
Pinched nerves. The patients that come to our office, yes, we see quite a lot of this. Typically pain generated from the spine that's causing an irritation or even a radiating type of pain. But yes, we see quite a lot of pinched nerves in our office.
You know, and I would imagine a lot of patients just randomly throw that out there. I got a pinched nerve without really knowing what's caused. Is that a fair statement?
That's pretty common. Yes.
Okay. Let's say that somebody does. Where are all the common areas of having a pinched nerve, and what are some of the common reasons that cause pinched nerves?
Common areas, just to run off a few of the common areas, you can have pinched nerves in the cervical spine, in the lower lumbar spine. You can have a pinched nerve in the elbow, where it's entrapped in the elbow, in the wrist, where people commonly have something called carpal tunnel syndrome. You can have an entrapment of a nerve in a lot of areas of the body, but the common causes of these pinched nerves can be things like pulled muscles, torn ligaments, misaligned vertebra of the spine, or even disc injuries, or even actually severe arthritides or problems within the joints of the spine.
Well, let's talk specifically. Let's say somebody has a pinched nerve, let's say in the spine, the neck or the low back. What are you seeing as the common causes of that pinched nerve?
The most common causes, believe it or not, is usually disc injuries. Disc injuries, or discs themselves, are the soft tissue or cartilage from in between each one of the bones of the spine, and they have a very specific position and space that they're supposed to occupy within the spine. If they're damaged or distorted or disc-shaped in some way, then that misshapen or expanding of that disc is going to push it into a nerve. Why? Well, because of in between each one of the bones of the spine, there is a nerve root that comes off of the bones, or comes out from in between these bones. If that disc swells, it begins to press back into that nerve, causing that nerve pain.
So when you're examining somebody, can you actually see a pinched nerve on an x-ray?
You cannot see a pinched nerve on an x-ray. What you can see are, you reference that pinched nerve from kind of backward engineering it. Okay, we can't see the nerve, but we can see that the disc space that should be here is completely gone. We can see that the bone that should be sitting here has shifted way out of position. So there are other things that you can get from an x-ray to tell you that most likely, yes, we have a pinched nerve, while still not being able to see the nerve itself.
I see. And then what would be some of the common symptoms? If somebody has a pinched nerve in their neck or their lower back, what would be some of the common symptoms they'd experience?
Common symptoms you're going to see are obviously pain. That's usually the most common, and one of the things that usually brings the patient to our office. Other symptoms you're going to see are going to be the quality of pain or the site of the pain. With pinched nerves, it's usually a radicular type symptom where the pain can radiate down into an arm or two, or down into a leg, to an extremity. The other thing is the quality of the pain is not necessarily a dull pain. Pinched nerves are because of what you're pinching, and that is the nerve itself, and you're also pinching the nerve at the spinal level, which is the most sensitive part of the nerve. So the quality of pain typically shows up as a very sharp, stabbing type of pain. It's a very intense quality pain, and sometimes you'll even hear it called as a burning type of sensation. So those are typically what you'll hear, whether it's in the neck or the lower back. Those are the kind of qualities and types of pain that you see.
Is it a fair assessment to say if you're having radiating, burning, tingling, or numbness in your arm, shoulder, hand, or down into your leg, that to some degree you have a pinched nerve?
Yes, that's exactly right.
I know it's a generalization.
It is a generalization, but yes, most likely 9 times out of 10, that nerve is being affected in some way.
Okay, and you mentioned other areas where you can have a pinched nerve. What was that?
Well, we said things like the elbow, we have things like in the wrist.
What would cause a pinched nerve in the elbow?
Well, you have under here, there's the ulnar nerve, which runs through a tunnel within the bones. The bones are shaped in a way that allows for the movement or positioning of the nerve itself to protect it. However, sometimes if certain damage is done, or the bone structure itself loses proper positioning, or if there's deterioration within a joint, sometimes those nerves can be entrapped or pinched
Is
within
that,
that.
I don't know, but is that something that like a golfer or a bowler would, if you're using your elbow a lot or something?
Believe it or not, most commonly you see is tennis elbow.
Oh, tennis. Okay.
We see it a lot in tennis, but yes, you are right. And
Okay.
we do see it in golfers as well, and we do see it in bowlers.
Mhm.
Bowlers more towards the shoulder, but it just depends
Okay.
upon the type and the motion of that particular person with the
Mhm.
activity that they're doing.
And the other area of the pinched nerve, I know is real common.
We said is carpal tunnel syndrome.
Yeah.
Pinched nerve in the wrist is typically due. There is a ligament that runs across the palm of the hand.
Mhm.
And under that ligament, there is a nerve that comes under called the median nerve. And it runs into the palm side of the hand. Typically, it is an overuse injury from someone that types a lot or does the same activity over and over and over with their hands. That ligament can lose some of its strength and begins to flatten the palm of the hand, causing a pressure or a compression of that median nerve.
Mhm.
That causes some significant pain.
Last question is, what's the most common pinched nerve that you see as a chiropractor?
Most common thing I see as a chiropractor is typically going to be some type of pinched nerve either in the neck or the lower back.
Okay.
And in America right now, low back pain is one of the #1 causes of pain for people. So
Mhm.
that pinched nerve in the lower back is typically the most common.
For you, okay. All right, very good, and that was very informative. And again, we're talking with Dr. Garrett Bode. He's a chiropractic physician right here in Oldsmar, Florida. And we're talking about some of the common causes of pinched nerve. So again, if you feel you're having a pinched nerve, feel free to give Dr. Bode a call.